Why do contact lenses give headaches?
So contact lenses don't always give headaches, okay? So they give headaches to some people. There are a number of reasons why contact lenses can cause headaches and eye pain. More than headaches, they give eye pain. The reason is, one, if you're wearing a contact lens beyond its expiration. Two, if you're not wearing the correct number. Three, if you're wearing a contact lens which is actually full of debris and it's scratching your cornea. Four is you're wearing it for longer than you should. All these, or if you sleep in a contact lens, that's the worst. So what contact lenses do, it affects the nerves of the cornea, right? And those, when they are getting
It
triggered,
affects the nerve all the time.
most of the, like in a lot of people it does, that's why contact lens wearers usually get a lot more dry eye, because it affects the tear film. You should have a smooth tear film. There should be a lot of boxes you should tick before you get contact lenses. Okay, and your hands should be clean. There are a lot of things to think of before you actually use contact lenses.
One is, of course, cleaning and putting it on.
Yeah.
But I didn't realize that just the nature of what you're saying is just the nature of contact lenses versus specs, because they sit on this
It's
very fragile layer,
yeah.
is a problem in itself, basically.
Yeah.
So you're saying in general, anyway, contact lenses, no matter how good they are, will cause some level of irritation to the eye.
It does.
Even though you may be fine with it.
Yeah, you may be fine. But when a patient comes to us, we can definitely say if this is a contact lens wearer or not. You sometimes have allergy on your upper eyelid. Your cornea is a certain way. There may be some vessels which are coming onto the cornea because you're trying to get more oxygen in, stuff like that. So you can tell a contact lens wearer from one who doesn't wear contact lenses. So there are many things that go on in a contact lens user which causes eye pain. And then, headaches are usually because a lot of people think this is my glasses number, so my contact lens number is the same. And they just get it made without going to a doctor or without getting a fit. It's very important to go and get a contact lens trial fit. The doctor or the optometrist actually sees if that contact lens is moving with every blink, if it's suitable for your eye. Only then do they prescribe it.
So can you give me all the boxes to tick for someone, who has specs, who's like, I want to get contact lenses? What boxes should we tick?
Okay. So one is they should be old enough, to understand that contact lenses come with its own challenges. Two, you need to explain to them and they need to understand about contact lens hygiene, which means that the contact lens has to be cleaned with the lens solution, not under the tap water or something like that. Three is you have to make sure that that patient understands whether they're wearing daily contact lenses or not. So if it's daily, you have to get rid of it. If it's monthly, weekly, whatever, you have to make sure that all that is done. Lastly, when we are doing the fit for contact lenses, the number is very problematic. If it has a lot of astigmatism, if it, all that, we need to do a proper fit. When we're doing the fit, we see how it actually feels on the eye. We see that the shape it's taking is that of the eye. Once the doctor is convinced that this is not harming your eye, it's going to give you good vision, and we say, okay, this is a good fit. Do you feel comfortable? Yes. Then go ahead and use those contact lenses safely. However, if when we're putting the contact lens in, one part of the lens is, up and it's not flush against your eye, or it's too tight or too loose, it's not helping you as much. So then don't go ahead and get those lenses.
And the time thing, I think, is very important.
Time is very important.
A lot of friends I know have wear them the whole day, basically, because
because that's what they want to do.
Yeah. They hate specs,
Yeah. So there is a better solution if they want hate specs. But if you're wearing contact lenses, most people wear them for 10 to 12 hours, and that's the limit. You don't want your
but that's actually too long, you're saying.
It is, yeah.
Because
the less you can wear it, the better,
Right.
But sometimes the worst thing is sometimes people forget to take them off at night. And that is a big no-no, because you can come with horrendous infections in the eye because of contact lenses.
I think that happened to me once, a long time back, yes.
Yeah.
So if someone, has a late night and they, sleep and they forget to take out their lenses, party a bit too much, and they wake up in the middle of the night in the morning and they're like, oh my God, my lenses are there. What should you do?
So, usually when that happens is because they've gone out, as you said, partied a lot, right? Had a lot of alcohol. So already your body is dehydrated. Chances are that the lens is stuck to the eye. If the lens is easily coming off, take it off. If it's not, put a little lubricating drop, see if the lens is moving, then remove it. And After removal, I would suggest, if everything is okay, if you have even the slightest doubt, any redness, any pain, any feeling that it's not like I usually feel, go to the doctor on that same day, because you can actually prevent a potential catastrophe before it even comes. But yes, it does happen to people, and I think we put in a lot of fear so that they don't do it, because it can actually lead to a lot of damage. But if you've done it by mistake and you're okay, you've gotten away with something, don't do it again.
I think most 20, 25-year-olds would have had at least one or two times.
Oh, more than one or two.
Yeah. Usually you learn with one or two. I think it happened to me a couple of times.
I think
like,
once you get an infection, which you have to put drops regularly for,
then
you will never do it again. But my thing would be, don't wait to get that. Learn from your friend.
Got it.